Ureteritis means inflammation of the ureter, the thin tube that carries urine from each kidney to the bladder. It is not a very common standalone disease name in everyday medical practice, and many doctors instead describe the cause behind the inflammation, such as infection, stone irritation, obstruction, or reflux-related inflammation. In simple words, when the ureter becomes irritated, swollen, or infected, a person may develop pain, burning, urinary discomfort, fever, or blockage of urine flow. If ignored, it can affect the kidney and become serious. What happens in ureteritis? The ureter normally acts like a narrow pipe, pushing urine from the kidney down into the bladder. In ureteritis, the lining of this tube becomes inflamed. This swelling may be mild, or it may narrow the tube and make urine flow poorly. Sometimes the inflammation is due to a urinary tract infection, UTI, moving upward, while in other cases it happens because a kidney stone scratches the ureter, or because urine gets blocked and backs up. When urine cannot pass properly, pressure rises in the kidney, which may lead to hydronephrosis, swelling of the kidney. Causes of ureteritis. There are several important causes. First, infection is a major cause. Bacteria from the bladder or urinary tract may spread upward and inflame the ureter. Second, kidney stones are very common triggers because they can irritate, scratch, or partially block the ureter. Third, obstruction from scar tissue, congenital narrowing, tumors, blood clots, or surrounding pressure can cause inflammation. Fourth, vesicoureteral reflux, urine flowing backward from the bladder toward the kidney, can repeatedly irritate the ureter and increase infection risk. Less commonly, inflammation may happen after medical procedures, catheters, pelvic surgery, tuberculosis, or other chronic diseases. Symptoms and warning signs. Symptoms depend on the cause and severity. Many people feel pain in the side, lower back, or abdomen, often on one side. The pain may come in waves if a stone is involved. Other common symptoms include burning while urinating, frequent urination, urgency, blood in urine, cloudy urine, fever, chills, nausea, or vomiting. Some people may notice that they are passing less urine or feel that the bladder does not empty well. If the inflammation is mild, symptoms can be vague at first, but they may become severe quickly if blockage or infection worsens. How doctors diagnose it? Doctors usually begin with history and physical examination, asking about pain, fever, urine symptoms, past stones, UTIs, or surgery. The next steps often include urine tests to look for infection, blood, or pus cells. Blood tests may check kidney function and signs of infection. Imaging is very important. An ultrasound may show swelling of the kidney or blockage. A CT scan is often the best test if a stone or obstruction is suspected. Sometimes doctors may also use urine culture, cystoscopy, or special scans to see whether urine is backing up or whether the ureter is narrowed. Treatment of ureteritis. Treatment always depends on the underlying cause. If infection is the reason, doctors usually give antibiotics and advise drinking enough fluids, unless there is a medical reason to limit fluids. If a stone is causing irritation, treatment may include pain medicine, hydration, and sometimes procedures to remove or break the stone. If the ureter is blocked, doctors may need to place a stent or a nephrostomy tube to drain urine and protect the kidney. In some cases, surgery is needed to correct narrowing, reflux, or another structural problem. Rest, pain control, and follow-up are important because symptoms may improve before the actual problem is fully solved. Complications if not treated. Untreated ureteritis can become dangerous. The biggest risks are kidney infection, persistent obstruction, and kidney damage. If infected urine remains trapped behind a blockage, the person can become very ill and may develop sepsis, which is a life-threatening body-wide infection. Long-term inflammation may also lead to scar tissue and chronic narrowing of the ureter. In severe or delayed cases, one or both kidneys may lose function. That is why severe pain, fever, vomiting, or trouble passing urine should never be ignored. Prevention and self-care. Not every case can be prevented, but risk can be reduced. Drinking enough water, treating UTIs early, not holding urine for too long, and managing kidney stone risk are helpful. People with repeated urinary infections, known reflux, or previous stones should follow medical advice carefully. Good hygiene, safe sexual practices, and regular checkups may also help reduce urinary infections that can spread upward. Most importantly, a person should seek medical help quickly if there is fever, flank pain, blood in urine, or reduced urine flow. Early treatment usually prevents complications and protects kidney health. Conclusion. Ureteritis is inflammation of the ureter and is usually a sign of another urinary problem rather than a disease by itself. Common causes include infection, stones, obstruction, and reflux. It may start with pain or urinary symptoms but can become serious if it blocks urine or spreads infection to the kidney. The good news is that with timely diagnosis and proper treatment, most people recover well.